Before I start, I would also just like to say that I am, apart from working at the Karolinska Institute, I'm also the research leader of a Norwegian research foundation called ELIB, which means A Life in Movement in English. And I'm here to tell you about not only a study, but a research program that we have conducted in the Nordic countries during the last 10 years or so. Thank you. And I thought I'd just put the topic a little bit into perspective, because what we're dealing with is back pain and musculoskeletal pain. And as you've been told just now, they are recurrent or persistent conditions. So that means that if a patient gets back pain, he or she is likely to have it again and again and again throughout his lifetime. That's the most common picture. And some patients even get stuck with it and therefore have a persistent condition. Now, if we put our medical glasses on, normally those types of conditions would render some sort of preventive initiative. In public health terms, it's named secondary and tertiary prevention. And that means that you would typically leave a patient with maybe some medication to take on the long term, maybe some medication to take in the acute phases, and some advice on what to avoid and what to do. So looking at back pain or musculoskeletal pain with those glasses, we need some preventive initiatives. But as Professor Hartvigsen just said, the present evidence is really only about exercise and some patient education. That's where we were 2 years ago. Okay. But in chiropractic, we have traditionally used another approach, and we call it maintenance care. And what it is that you encourage your patient to come back to see you on a regular basis, really regardless symptoms. And this is an initiative that has been so far, before we started this research project, was unexplored. So we started to look into this. And we started by asking patients and chiropractors alike, why do you do this? And this is what they told us. They told us it was to prevent recurrent pain, to maintain function, and to stay pain-free. And of course, these are typical secondary or tertiary prevention initiatives. And we also looked at how common this was amongst our chiropractors in the Nordic countries. And they say that about a third of our patients is offered maintenance care. So it's not for all, but about a third of our patients. Then we started to look at what actually goes on in the maintenance care consultation. So we had a chiropractic student standing in the back of a consultation room, ticking a few boxes. And what they found was that there were some, generic components of maintenance care consultation. And those would be that a chiropractor would ask their patient how they are, what had happened, and they would do an examination and they would do some manual treatment. But there is also an element of something more. And that would have to do with more of a discussion around health in general. Maybe there would be a discussion around sleep, maybe about stress, maybe about cigarette smoking. There would definitely be some exercise advice in there, and also typically something to do with work, how work is affecting the patient's back pain and health in general. And then we started to look at, well, who are the patients that are offered maintenance care? And the chiropractors told us that typically they would be offering maintenance care to a patient who's had many episodes of back pain previously, typical secondary prevention. But they also told us that the patient needed to actually have some effect from the initial chiropractic care. So they would have to respond well to chiropractic treatment. And then the big question is, of course, is it effective to do this? And in order to study such a question, you need to do a randomized controlled trial, which is very hard. It took us a long time, but we did. So we did this across chiropractic clinics in Sweden. We included patients with recurrent and persistent low back pain who responded well to an initial course of chiropractic care. And they were randomized into two groups, the maintenance care group, and they were really told to come back on a regular basis, regardless symptoms, for a whole year. And the control group, these patients were told that if your pain comes back, or if it gets worse, come to see me, and they would get treated. And our outcome measure was days with bothersome pain. And we collected this measure by weekly text messages. So every Sunday afternoon, the patients would get a text message, and it said, how many days this previous week was your low back pain bothersome, i.e. affected your daily activities or routines. And this was a carefully chosen measure, because we didn't want the little twinge of a pain reported. We wanted pain that was significant to the individual, pain that would hinder them from, for instance, going to work, picking up their children, going to play tennis, and so forth. And this is the result. And the blue line is the control group, and the green line is the intervention group, the maintenance group. And as you can see, the people on maintenance care consistently reported fewer days of bothersome back pain throughout the year. And when we summed it all up, it amounted to 13 days fewer of bothersome pain. And of course, the question is up for grabs, is this relevant or not? And I would suggest it is, simply because this is pain that meant something to the individual patient. And in that equation, you also have to consider the cost of the treatment. And this result was achieved at 2 additional treatments throughout the year. This is our publication from that study. And I can also tell you, it's not published yet, but we have further looked into the subgroups of this patient population. And we have found that according to psychology, if you can divide people into different psychological subgroups, some people even have a greater effect from maintenance care. Thank you.